The price of this pandemic is not just costing lives, it is costing people their livelihoods. And that is leaving all of us wondering, where do we go from here? How do we safely reopen our economy without undoing all of the hard work that we have all put in to help stop the spread? We're very lucky today. Joining us is Sunil Chopra, a professor with the Kellogg School of Management at Northwestern. Professor Chopra, thank you so much for spending some time with us this morning. We appreciate it. I'm going to dive right in. Social distancing is saving lives. We have concrete evidence of that, but it is coming at the cost of our economy. How do we figure out if the benefits outweigh the costs?
So if we look at the costs of social distancing, I think they fall into three broad buckets. First is obviously the people who die. That's important not only for the families, but it also costs the economy through healthcare costs of taking care of them. I think second, we have to recognize that there is a huge reduction in economic activity, partly because demand has dropped, and partly because supply has dropped. People are not able to run their businesses either because the business is required to be shut down, or in many instances, they cannot find the employees given the coronavirus. So the costs are quite significant in terms of reduced economic activity, but the costs are also quite significant in terms of deaths and healthcare costs.
And you say that if we start opening businesses too soon, which is actually happening in Georgia, we're watching that very closely. The state is opening some businesses, that it could actually cost us more money long term.
I think here the important point to remember is that when I go out, I not only impact my health, I impact other people's health. And that's the huge problem with opening too soon. None of us knows what is the right pace at which to open, but we've seen over the last 6 weeks that social distancing has had a significant impact. And keep in mind that we've had 45,000 deaths because we did not start social distancing early enough. So the wrong thing to do would be to open up too fast, because we won't find the results of opening up too fast for another month, and by then it might be too late. We might have to come back to where we are now. So if you open too fast, the potential benefits of opening for the economy are going to be very short term, but the costs could be very large in the long term.
All right. I know you say that this is more like an insurance policy that we're purchasing.
Well, none of us knows what is the right pace at which to open. So the key thing to do here is we've gained a lot from the last 5-6 weeks of shutdowns. Now, we want like an insurance that we keep the benefit of all the actions we have taken so far. And the insurance is in the form of opening a little slower than optimal, because if we go too far, then it's very difficult to come back without another shutdown. So like we always buy insurance for when we are driving, because we can impact other people. We have to think of this the same way. The insurance is that we start opening a little slower than what many people want to do, but we keep adding to that as it seems to work.
All right, Dr. Chopra, thank you so much for joining us this morning. I know that that's still very difficult for people to digest as they are just trying to put food on the table, but we appreciate your perspective. Thank you.
It's a pleasure, Zoraida.